We begin the day with countries around the world monitoring and quarantining passengers evacuated from a cruise ship hit by a deadly hantavirus outbreak.
The number of hantavirus cases has increased to as many as 9, but because the incubation period can be up to 8 weeks, according to doctors, the Director General of the World Health Organization says they fully expect to see that number increase even more, although he did reassure that there are steps being taken to try to contain this virus.
We're seeing people in hazmat suits. Some of the patients who were infected on the ship, they are being treated in biocontainment units that are designed for Ebola. There's 42 recommended days of quarantine. You say we're being very cautious here. All of what we're seeing, is that because the virus is especially dangerous or because doctors still don't fully understand this outbreak?
What more do we know about the Andes strain, how it might differ from the other strains?
So the Andes strain is the only strain where we have mapped human-to-human transmission. And I caution people because when we say human-to-human transmission, we're talking about people who develop symptoms. But because we're not testing populations with RNAs, we don't really know whether there are subclinical cases. So there could be more human-to-human transmission than we actually see. It's never good to track viruses through symptoms. We should be tracking viruses through blood tests like PCR. We've learned that with COVID. Extraordinarily helpful. Many universities were able to open and schools were able to open because they provided weekly testing and it really prevented spread. So we know how to deal with these viruses. We just need to move into the 21st century and make testing more widely available to those who need it.
On more cases, as I said it in my speech, we would expect more cases because, as you may remember, the index case, the first case in the ship was on April 6th. And until the report was confirmed as infectious, that's around April 24 or 25, there was a lot of interaction actually with the passengers. And as you know, the incubation period is also 6 to 8 weeks. So because of the interaction, while they were still in the ship, especially before they started taking some infectious prevention measures, because of the interaction, we would expect more cases because of some of what happened during the travel actually, until hopefully the interaction until April 30th. After that, of course, they have improved the measures.
There are a further 2 suspected cases, while 3 people have died from the illness. The outbreak is believed to be the first linked to a cruise ship and has prompted an international response, with passengers now returning to more than 20 countries. Health officials say the strain can, in rare cases, spread through very close human contact, unlike most forms of hantavirus, which are usually linked to exposure to infected rodent droppings. Here in Germany, 4 passengers have been moved into quarantine in their home states after a medical assessment in a clinic in the city of Frankfurt. There's no indication of illness among them, according to a statement issued by the clinic. The World Health Organization says the overall risk to the public remains low, but is recommending active monitoring and daily health checks for passengers who may have been exposed.
Because based on the request WHO made, he accepted. And the request I made was based on international health regulation. And countries are expected to cooperate based on that international health regulation. But not only the IHR, I think we should also be strong believers of solidarity. Solidarity because that's our best immunity. It's only when we support each other that we can respond more effectively to viruses or to outbreaks like this. And it's also a moral duty.
Now, tell us, why are countries using quarantine-style measures for a virus the WHO says is low risk?
Yeah, first of all, it's always, as an infectious disease specialist, smart to be cautious here, and there are special circumstances here. as we have this human-to-human transmission on the boat, and all the information is not yet complete. And on the other hand, the virus has a high lethality, and this together is really, considering the recommendations, the current recommendations, is all reflected in how we protect ourselves and also the environment and the population.
Yeah, this human-to-human transmission we saw on the cruise ship, that's fairly rare. I keep reading that it's spread through very close contact.
You're looking at what's now a temporary home for a group of Americans who sailed on the MV Hondius, the cruise ship with a deadly outbreak of the Andes strain of hantavirus. These specially designed quarantine rooms at the University of Nebraska Medical Center are where they'll be monitored and assessed for symptoms for up to 42 days.
No one who poses a risk to public health is walking out the front door of the streets of Omaha or beyond.
Sunday night, 18 Americans aboard the MV Hondius were repatriated to the United States.
Passengers were transported via Department of State plane from the Canary Islands to Nebraska with appropriate medical capabilities on board.
Of the 18, one who tested positive and another, believed to have been exposed to the virus, were flown to Atlanta for evaluation at Emory University Hospital. 16 remained at the University of Nebraska Medical Center quarantine unit. This isn't the center's first cruise ship emergency. It was used in early 2020 to repatriate Americans from the now infamous Diamond Princess cruise ship with more than 700 COVID cases on board. Health officials stress this is nothing like 2020.
Let me be crystal clear. The risk of hantavirus to the general public remains very, very low. The Andes variant of this virus does not spread easily, and it requires prolonged close contact with someone who is already symptomatic.
In addition to the 18 Americans who just got off the ship, 9 other American passengers disembarked at earlier stops before the outbreak was detected. They're all being monitored across 7 states.
We're expecting this next briefing from health officials at 10 a.m. Eastern. What are you hoping to hear, and how worried are you by this story?
Well, I'm not worried. I have complete confidence in the Trump administration. I think we learned a lot of lessons, hopefully, from the COVID pandemic. And I know they're taking this very seriously. And hopefully this won't spread, and this will be an isolated incident. And we can learn from this and hopefully educate other countries on how to contain this.
But the second part is passengers now have left, and they're in their respective countries. So as Prime Minister said, the countries are taking responsibility, and all the measures are being implemented by countries. Of course, as previously asked, earlier question, there are differences from country to country. This could be because of local situations. But at the end of the day, the countries actually take responsibility. And I hope they will take care of the patient, the passengers, helping them to the best they can, and also protecting their citizens as well. That's what we expect.
Do you understand public concern about this? The memory of COVID is still very fresh. We remember the pictures of back in the day. Everyone says this is not the same, but the fact that it does very much seem like we're not entirely sure how this is spreading from one person to another. And it does kind of give the sense that there is no full control of the situation, at least. If everything goes according to plan, that is. The WHO came out today saying that they cannot discard that there will be more infections. At what point would epidemiologists begin to worry that this outbreak is becoming something more serious?
The point to worry would definitely be if infections turn up and are detected in persons which cannot be traced down directly to the cruise ship or to their direct contacts. And this is the important point. For now, we are really, and that is the authorities are after those, are really monitoring and in contact with the passengers, with their contacts, and are evaluating how high is the risk, do they have symptoms, test those persons, and then it's the challenge to decide how the management is done. But this is also the reassuring part here, that authorities and treatment centers and the WHO and the ECDC are really like working together in managing this situation.